Welcome all sports medicine physicians, occupational therapists, and chiropractors. My name is Jasmine Ward, and this is my presentation on chronic pain management and the underestimation of alternative methods. The objectives of this presentation is to discuss the importance of having adequate coping resources, teaching relaxation techniques, and imagery techniques. So what is chronic pain? Chronic pain is pain experienced 3 to 6 months after the injury or treatment. It is the leading cause of long-term disability in working adults in America and can range from $215 billion annually to treat. Chronic pain has been seen to increase internal issues such as depression, anxiety, and financial frustration. Additionally, chronic pain has been seen to decrease the quality of life. Using biopsychosocial model, physicians have tried to gain a better understanding of the experience of pain by examining the patient's physiological state, thoughts, emotions, behaviors, and sociocultural influences. 20 to 30% of all adults experience some type of chronic pain. It's more prominent than diabetes, heart disease, and cancer combined. Pain medication has become the second most prescribed drug in emergency rooms and physicians' offices. Recently, there has been strides made to bring alternative medicine to the forefront of pain management. However, as previously mentioned, the biopsychosocial model is very important and efficacious to the treatment and maintenance of chronic pain. It views chronic pain as an illness rather than a disease and recognizes that it is different for every patient and should be aimed at being managed rather than cured. Pharmaceutical methods tend to overlook the cognitive components of chronic pain and its factors contributing to its maintenance. Alternative methods such as relaxation and imagery has had significant beneficial effects on patients that deal with chronic pain. So why are coping resources so important? The way I would best describe coping resources to a patient is the hypothetical tools in a very personal toolkit. In life, there are going to be situations that demand particular resources, whether that be daily life stressors, unexpected stress, or most often injuries. Not having tools to deal with the situation can cause recovery to be very difficult and painful. I think it's important for sports medicine professionals to stress the fact that some pain is often made worse by perception and high appraisal, but with the help of coping techniques like meditation, imagery, and relaxation exercises, it could possibly make the healing process a little bit smoother. Once again, having adequate coping resources does not only apply to injuries. Once you have all the right tools in your toolkit, your daily lifestyle could become a little bit easier. What are some alternative coping techniques that you as a sports medicine professional could give to a patient before prescribing them pain medications? Relaxation techniques. Relaxation training can be very beneficial. We all know that stress is commonly recognized as a key factor in chronic pain. When stress is a factor in any situation, the sympathetic nervous system is often at play. Through different relaxation training methods, physicians strive to deactivate the sympathetic nervous system and activate the parasympathetic nervous system. Techniques can be practiced individually or coupled together. For example, diaphragmatic breathing. Patients are instructed to use the muscles of their diaphragm as opposed to muscles in their chest. This allows the lungs to expand down, increasing oxygen intake, and also deactivating the nervous system and activating the parasympathetic nervous system. Also, progressive muscle relaxation. Engaging in a combination of muscle tension and relaxation exercises is used to reduce symptoms of stress, anxiety, and certain types of chronic pain. One of the body's reactions to fear and anxiety is muscle tension. This can result in feeling tense or relaxation can lead to muscle aches and pains, as well as leaving some people feeling exhausted. Think about how you will respond to anxiety. Progressive muscle relaxation is also an excellent tool to help learn about the body and the signals it may be telling you. With practice and time, you can learn to accurately identify and diminish the signs and signals of stress and tension in your body. Imagery techniques. Imagery is a cognitive technique that can be used to create or recreate a scenario to decrease pain or encourage a positive outcome. The use of guided imagery coupled with pharmacological treatments decreases pain and potentially promotes healthy healing at a faster rate. Overall, imagery techniques can be used to create vivid and safe environments to distract from your pain and pain-related thoughts. So, to conclude, understanding the importance of coping resources and using alternative treatments to decrease pain can be cheaper and very beneficial. We can remember it costs $215 billion to treat pain annually. So imagine if we can give these techniques away for free, how much money could be left over for other medical research or medical aids. We must first educate the patient on the injury and inform them on alternative treatment options, and then become educated on relaxation imagery techniques to teach it to the patient. Thank you for listening. These are my references.